coffee and desserts, but we're going to start to get back with the program a little bit. I want to invite any legislators in the audience that would like to join me on stage to come up at this time. Ooh, taking a big step.
I know there were more of us supposed to be here.
I know there
We
were.
may be the only people right here right now.
It's not quantity, it's quality.
It's quality. It's all about quality. We're representing our colleagues. Yeah. Wait.
So I want to thank Representative Jane Garibay and Representative Ann Hughes for being here with us today. And the second award that we want to present today is to someone that is not here with us, and that is the late Representative Quinton Williams. Quinton Williams was a force. He was a force for happiness, joy, and change. The change that he was able to make was incredible, and he really worked with us to ensure that the residents in Connecticut had access to the same things that people in the general community had access to. And during COVID, I would regularly get phone calls that started with, "Madam Ombudsman, we need to do something about this." He would hear that residents didn't have the opportunity to have the technology of their choosing. Internet access, the ability to communicate with loved ones, to simply get online and search for something, right? To have access to their community at large. Rep Q, as many of us referred to him, was a huge member in his community and very active in his community. And it was really important to him, and he really couldn't imagine a period of time when, if he needed to be in long-term care, that how come he couldn't continue to be active in his community, and why would that have to change? And so the E-Board members thought it was very important that he be recognized for the work that he did. So the legislature and I wanted to make sure that we honored him, and we are honored today to have two of his family members here, Yolanda Williams and Dee Williams. So if you would please join me on the stage so that we can present you with the award in his honor.
Good afternoon. I'm Dee Williams, and actually I'm Q's cousin, but he always called me Aunt Dee. Q, as you can imagine, we miss him terribly, but we're so thankful to everyone here and throughout the community and the state that still remembers his legacy and promotes the things that he believed in. Unfortunately, his mother and his wife were not available, but I am so pleased to be here to represent him and thank everyone for this award. Yolanda, do you have something to say? Thank you.
Thank you so much. Look at that bright smile on that screen. I do miss that. I am glad that we have someone that remembered to take pictures during our day, too. Our new and fabulous Deputy Commissioner. Thank you. And so now we're at a rather fun portion of our day. We are at the resident raffle.
All right.
Come on, Tasha, it's your fun time, so you could take it from here.
Hey, ROs, we need you to start grabbing the bags. And we need the mics for the ones that are going to be answering some questions. This year we have some questions that if you answer them, you win the prize. And then we're also going to be doing our regular raffle. So everyone should have gotten a ticket in their badge. So, and we'll interchange. So the first question: during normal business hours, nursing homes have a right to restrict visitation times to specific hours. Do nursing homes have visiting hours? You gotta raise your hand.
Oh, we got somebody right here. This gentleman with his glasses on, he got his hand up fast. What is your answer?
No, they don't. They can come in anytime.
That's right.
That's right. Okay, we have one here.
We have a winner over here. All right. Next question. Can residents' rooms be searched if they're not present? Wait a minute. We got to raise hands. We got someone right here. We have a mic. Yes. No, they're getting it now.
We might be in trouble here. These guys are fast.
No.
No, you're right. Your rooms cannot be searched unless you're present and you give permission.
Get this man a prize.
All right. Next. Residents can review their medical records only when there is a change in medical condition. Let's see some hands. I'm gonna go in about right there, Mairead. Yep.
This gentleman right here who did the Pledge of Allegiance for us. Is this true?
They can go, they have access to their medical records anytime they want.
Correct. Okay, thank you, Brenda.
All right. Facility administrators must be invited to attend all resident council meetings. I'm gonna go. All right, we're gonna pick you, sir. What's the answer?
Yes.
Nope. Somebody else? Nope. That's not true. That's not. The administrator has to be invited. Remember that they have to be invited. If you do not invite, they cannot attend. And that's all staff. Okay, next question. Residents who have Medicaid must pay for copies of their medical records. I saw him right here in the light brown sweater. Right in back of you, Keo. Right in back of you.
What was the question?
Residents who have Medicaid must pay for copies of their medical records.
Right, yeah.
Nope.
No, you don't have to.
Residents, that's false. Residents do not have to pay for their medical records. They have a right to view them within 48 hours. Residents do not have the right to request a copy of their grievance.
Back here.
There's one right in back of you, Mairead.
Right here.
Say it again.
Residents do not have the right to request a copy of their grievance.
False.
That's true. Residents have a right to get a copy of their grievance. All right.
Keo.
Do residents have the right to a second opinion?
Right here.
All right. I got someone in green, Keo, someone.
Yes. Yes.
The green or the pink shirt? They both have.
Yes.
Tosh over here.
Oh, okay.
Yes.
Yes. True. All right. We got to get some in the front row here. Nursing homes can restrict resident assessments for least restrictive environment if they believe community placement is not safe. I'm going to repeat it. Nursing homes can restrict resident assessments for least restrictive environment if they believe community placement is not safe.
That's true.
That is not true.
If they feel
Assessment, everyone has a right to an assessment. Everyone.
oh, assessment.
Yeah. Okay. And this will be the last question. And then we're gonna go to raffles. Families have the right to organize and participate in family council. There we go. Keo, go right ahead.
Yes.
That's it. All right. All right. And I am just waiting on the, oh, here they go. All right, get your tickets out, everyone. Get the tickets. We're gonna roll the cannon as it's in the back of your ID.
The back of your name tag should have a little ticket in it.
All right. Give it a good shaky shake.
Oh, you got it? All right. Martha's got it.
All right. No, I don't have any glasses on. This gonna be.
Jesus, we have
Woo.
problems with glasses. Our whole team
Goodness.
is lacking glasses.
All right.
Come on, Tosh.
458158.
Bobby.
All right, Bobby.
Bobby already got a blanket, so he doesn't get another one.
All right, we're gonna pick again. Pick again.
You already got a blanket. You don't get another one.
458159. 458159.
Okay, his neighbor.
All right. All right,
Look at
e-board.
This is a lucky table over here.
All right, e-board.
We did not stack the e-board. They're just lucky. They put a lot of work in.
Okay. 458108. 458108. Guys, I'm gonna grab off the bottom.
All right. We're going to count to 5 and we're moving on. 1, 2, 3, 4, 5. Okay. We got to keep going here. We got to do open panel. What time is it?
Best part of it. All right. 458092. All right. Woohoo. All right. 458.
Pull it off a little bit.
458029. 458029.
Next one. It's one of us.
That's Cindy. Come on.
Cindy, you can't.
You don't
win.
get one, Cindy.
458053.
Yay.
How many we have left? Oh, okay. 458077. 458077.
Keep going.
458042. 458042. 458162. Oh, I heard we got it.
Here you go.
All right. Grab some more here.
Nope. There you go.
How many we got? 3?
4 more.
4 more. Okay.
5 more.
458156. 458156. All right.
Got one
nice.
there.
458118. All right. 458015. All right.
Right behind you there, Daniel.
458171.
Oh, we already got one.
Okay.
He's already got one.
Moving on. One more. Two more. 458135. 458. Right there, Dan. 458117. 458117. Over. All right.
Got one more, Tosh.
And one more. Okay. 458065. 458065. No. Okay. 458006. Yay! All right.
Okay, now we are going to do one of individual's favorite part of the day. We're going to do a panel discussion. So can I have the panelists come up to the stage? I'm going to mediate from the middle a little bit, I think. Hey, Tosh, can you, or Dan's going to take that down? I'm going to have, come on up, Guy. Guy, who is our Medicaid director, is going to join us. He is going to take questions about Medicaid first because he has to leave us earlier, but he's been so gracious to join us and take a few questions at the beginning related to Medicaid. So if we have those, we're going to take Medicaid-related questions first. So Barbara Cass, Judy, Toby, and John's coming up. Thank you, darling. You're the best. I don't want John up near the edge, so we'll keep him over here. John, maybe in the middle. No, wherever you'd like. Maybe you can go on the edge.
Sure, yeah. Do all the voices, right?
Yeah, I'm just gonna put this over here for now so we can get John. Oh, yeah. And right here. You're gonna go right here, John. You guys can pass it. And can I have two of the other mic? No, never mind. You got two out there? Okay.
Thank you.
John, I need to plan better next year. Okay. This goes to you two. All right. We made it. Okay. So first, if anyone has a Medicaid-related question, raise your hand. Or DSS, Department of Social Services, Medicaid-related question. All right, I see one here. Keo, thanks.
How do you know if when you call that you're talking to one of you people? Because there's a lot of scammers out there.
Oh, it's a really good question.
That's such a good question. Our number is on our website, and I think the best way to know is to call that number directly. That's the best way to know you're calling official state employees versus someone who's trying to scam. Sorry?
.gov.
It's a .gov, yeah. Yep. If you Google Connecticut Husky or Connecticut Department of Social Services, it's right there on top. It's in bold.
That's great advice. So if anyone calls you looking for information, hang up, go to the website, and call them.
Yes.
Great advice.
It's a great question. Thank you for that.
Bobby has a question over here. Tosh?
Yes, I've been in contact with a representative from the National Disabilities Organization, and I mean, this is a real lady that's in it. I know she's for real, but you have no connection with that at all, do you?
Good question. We don't have a formal connection, but based on the little bit that you shared, it sounds like they're doing really important work that is very much aligned with our mission, but no formal connection.
Okay.
Another question here.
Okay.
But can you discuss more about the money follow the person?
Absolutely. So Money Follows the Person, or MFP, is a program that helps residents who are at nursing home level of care live in the community safely. And it's called Money Follows the Person because, as you know, nursing home care is expensive. And Money Follows the Person recognizes that those same dollars could help people who want to live in the community do so safely. So if someone, for example, is in a nursing home and is in a situation where they want to live outside, under the Money Follows the Person program, the money that the Medicaid program is paying for the nursing home will literally follow the person into the community. And so our team will work with interested parties to explain how the program works, to talk through barriers, because often there are really important barriers to work through if one wants to leave a nursing home and live in the community. For example, supportive housing, you may need modifications, you may need a ramp built to your home, you may need some technology to make living at home safely. Under the Money Follows the Person program, our team will meet with you, discuss how the program works, describe your options, help you figure out if it's what you want to do, and then if it is, we'll work with partners to help that transition be safe and effective for you all. If you want to learn more about the Money Follows the Person program, there are a variety of ways of doing it. One is to on your phone or the internet to type in Money Follows the Person Connecticut, and there's the contact information there. As well, the Ombudsman's team, we work really closely together, and they can connect anyone who's interested. I know this morning there was a really good call out that maybe doing some regional meetings to describe the program so that residents understand their options. I'm really excited about that, and my team, assuming the Ombudsman will have us, we would love to take them up on that opportunity.
I think that's a great idea. So we'll connect in the next week or two. We are actually in the same building, and I have to say, for Medicaid offices, these guys are so accessible to us. So we literally can just run downstairs, or they're a phone call away, which doesn't happen in every state. So you guys should feel really fortunate that we have that accessibility to our Medicaid office.
It's a great partnership, yeah.
Keo?
Hi, I just have a follow-up question to the MFP. Great information you just provided. But I've never been able to get a straight answer just for education purposes. So with the Money Follows the Person program, is there a financial cap per individual? And when residents get into the community, is there a cap on how long the services are provided by Money Follows the Person? For example, are things subsidized for 1 year? Or does money, when the services are put into place through Money Follows the Person with their assistance, does the person eventually have to be completely self-sufficient and independent after, like I said, a year of that transition with the assistance of MFP?
Great, that's a really, really good question. I'm going to answer it specifically, but let me just, before I do, take a little bit of a step back and say that Medicaid has a variety of services for people who qualify for long-term services and supports. And I will confess, even as the Medicaid director, the programs can be confusing with different eligibility criteria, different wait lists, different maximum benefits. It is a patchwork quilt, as we like to say. So I think the most important piece of advice is I want to echo what Marie had said earlier. The most important advice I want to give you all is to talk to the staff. Our staff are trained to help you think through all the different options and programs that are available to you. And the reason that I'm emphasizing that is your questions are good and specific to Money Follows the Person, but if you may qualify for other programs as well, and I wouldn't want someone to think that living in the community isn't an option simply because one program doesn't necessarily meet all of their needs. On the Money Follows the Person program, there are limits and dollar amounts, but again, I want to emphasize there are other programs that don't have those, and so I think the best piece of advice is to talk with the staff and help them understand your situation, what you need, and then think about how we can serve you. I don't know if you want to add anything.
The only thing I would add is that Money Follows the Person is 365 days. So people often say a year, but it's actually 365 days, which is important because if you have a hospitalization or you have a stay in a nursing home, that would extend the person's stay. And people worry about dropping off, but it's like being paid out of the checking and then the savings. So the person receiving the care, as long as they do their redetermination and they are eligible financially, they shouldn't notice a difference because Medicaid, if they're eligible for Medicaid, who's paying the bill shouldn't change the services as long as the person continues to need that service and they are financially eligible. They should continue to be able to receive those services. It's about, Medicaid worries about, do you financially need it and do you physically need it? Those are the requirements for services under MFP, but more globally under Medicaid. But to Guy's point, there are different services and packages, and even once you're on the program, you might decide you chose one thing, but then when you meet with your care plan counselor, or your, help me guys, case manager, thanks Q. I've told you guys this before, Friday of Voices, it's about 2 o'clock, I'm gonna not be able to talk anymore. When you meet with your case manager after year 1, they're gonna counsel you again, right? After, I just said it, year 1, day 365, they're gonna go over what the services are and you might wanna make other choices. So you're never pigeonholed in. That's the best part about this program and the programs that Medicaid offers is that it's about choice. Okay, question in the back.
One other
Yuki?
quick, just
oh yeah.
One other quick thing. We strive to have a no wrong door policy. And what that means is, as I mentioned, there are a lot of different programs. They can be very confusing. We strive to make sure that no matter how you come to us, we will work with you to try to meet your needs. And if you happen to come in, and as Marita said, if you happen to come in on one program and another program is better, we strive to make that as seamless and as easy as possible. So the number one piece of advice is just to, every situation is a little bit different, and to talk with the case manager. The state has a real commitment to helping people who want to live in the community doing so, and we want to work with you to meet your needs there.
Me.
We got one right in the back.
Excuse me. Could you please tell me if there's some kind of an idea about how long does it usually take once a person applies to that program for the program to give you an answer? The reason why I ask is because I have known a couple of persons that had applied, and it's been years and years, and they still have not received a reply. That's my first question. The second one is there is a limit of how much money are you allowed to receive or to have in order to qualify for that program? And the third thing that I want to say is that it seems to me that there's so much lack of knowledge of what this program does and how it works that I will probably recommend that the next time that we have a meeting here, that we invite somebody to come to have a little bit of more time to be more explicit and to be able to answer the questions.
Great.
I guess we know what we're doing next year.
I was going to say, if the organizers would have us, we would be honored.
Okay.
We could have a companion to the awesome description of Medicare that we had earlier this morning. So let me make sure I got them right. On your second question, you're asking about income limits. And the answer is yes. Medicaid is a means-tested program where, depending on your income, you will or will not qualify for the program. In some cases, your assets as well. There are different limits for different programs, and depending on whether you're over 65 or under 65, it's a little bit, the details really matter, but yes, there are income limits. On your first question, on the amount of time it takes to process the applications, there are two separate issues I want to highlight. On your first question, the amount of time it takes to process the applications, there are two separate issues I want to separate out. The first is some Medicaid programs do have wait lists, period. The legislature has approved a certain number of slots, and people go on wait lists for as many as several years to get on those programs. So those are real, and we have data and transparency on those. The second issue is, even when they're not wait lists, to qualify for Medicaid, we need to verify, as Mairead said, that people financially meet the program and medically meet the program. And that process of financial eligibility, depending on your circumstances, depending on if you have stocks and bonds and retirement accounts and real estate, can take time. It is one of my priorities to make that as fast as possible. But often, and I get reports every week of the number of people who are applying for a program who've been waiting more than 30 days, 45 days, 90 days. And I know from personal experience how challenging it can be to have a family member waiting to hear back from the state. When typically the cases that are really long, like it seems like you're referring to, are cases where we're trying to get financial information from the applicant or her family, and there sometimes can be complicated to gather all the bank statements if the resident has moved between states. That process can sometimes take a while on the part of the applicant or their family. But I just want to say I know this is a real barrier, because every day that people are waiting to be on the programs is a day that they're not being served. And I'm working really hard with the team to try to make that as speedy as possible. But know that we do, under federal law, we do have to do those financial reviews. And that's typically why things take longer than we all would like. Yes.
I'm curious to know about the percentage of people that apply every year that are accepted in the program on a yearly basis. Because I keep hearing about how long it takes and how complicated and how many appointments they have to meet to get accepted. And then time keeps going on and on and on, and even some of these people pass away.
Yes.
Because their age keeps going up and up and up, and there's no way of getting in. Is this a federal program or a state program?
I think she needs to be invited to steering committee.
She is on the steering committee.
It is a joint federal-state program. The feds pay most of the bills and set the broad regulatory structure, and then some of the details in the administration is done at the state
So
level.
it may vary by state then, if the state is involved.
Yeah.
In some states, it might be different from the next state.
Yes. No, I agree. I think these are all good points, and
Well,
yeah.
thank you so much, and
Let's
I hope
go ahead and
that
make back.
next
Thank you.
time that we come, we can have somebody. I'm not saying you, that you're not doing a good job. I'm just saying somebody that is from
No, I
that
appreciate it.
program that can come in and be a little bit more explicit and give some.
Yeah, no, thank you for your input, and I really appreciate those comments. Thank you.
Thank
Yep.
If you're willing, and Kyo, you're right there, if she wants to share her information and be invited to either, we said MAPOC
Yeah,
or
that'd be
the
great.
steering committee, we'd really like to engage her. Okay, great. Tosh?
Hi, my name is Christine. I have a question on housing. So I understand that there's a shortage of apartments for rent that's handicap accessible, etc. Is there any plans in the future to develop a community, like a 55 plus specially designed just for your program? Because if housing is so difficult to find, I know landlords don't want to rent to convicts or so and so. Is there some future program that you guys are thinking about? Because I know we're trying to limit nursing home and putting people in nursing homes when they don't need to be. Is there any like group homes that you guys consider?
Yes, great question. The answer to your question is yes. This is an active area of policy discussion for all the good reasons that you mentioned. So yes. In fact, CMS has recently, the federal government has recently changed some of the rules, making it easier for Medicaid programs to have housing supports covered under Medicaid. And that's something that we're actively looking at, and I think would at least partially address some of the issues that you raised.
And that's actually a conversation that we have. I feel like it's constantly coming up. And I want to be so respectful of Guy's time because he does have to leave. So thank you, and I so appreciate you being part of the
And I just will say the reason I need to leave is actually talking with our federal partners at CMS on exactly the issue that you raised.
Well, go.
So when I say it's under active discussions, I really do mean that. So thank you for inviting me.
Thank you for being here. Okay, I see a couple of hands up. There's one in the back with Keo, and then I see Martha's hand up. So Keo, we'll start with you, and then Tasha's on her way to Martha.
Hi, my question was, and the gentleman's gone now,
We'll try to answer it.
and I might sound very ignorant, but how long has the MFP program been in existence?
That is a good question. I believe here in Connecticut, where's Julie? 2008. Oh, good. I was going to answer it correctly. 2008. And we probably couldn't even. Julie, do you want to join us up here on the panel? Because you might be able to answer some of the MFP questions. And when Julie walked by a minute ago, you guys might notice that our team members all have blue on. This is our color. If you see this in a nursing home, you can ask if they're a regional ombudsman. And I was so happy Julie kind of matched us today. And actually, so do you. All right. So UConn has worked with MFP, and some of the questions in the back related to housing, and I was going to also say she should look at some of the study and research that you guys do on a quarterly basis related to some of the barriers.
Yeah, we maybe you could link to the we have a website that's a UConn Health Research website for the Center on Aging, where we do quarterly reports for really anybody who's interested in it's essentially for the steering committee that Mairead mentioned earlier, the rebalancing steering committee, but quarterly reports on the MFP program, and it describes, and it's mostly figures and graphics, and it describes the 5 benchmarks that the state is being measured on all the time, and how the metrics on where they are with those benchmarks, quality of life indicators,
transitions, barriers to transitions,
yep,
all of that.
Yeah.
So we can share that, and even maybe
there
Dan
is
can
some
link it
housing
to our
information in
website
there.
to get it to you guys.
Yep.
All right. Thank you. Martha.
My name is Martha. I don't know if you can help me with this, but I have been sitting on 4 very sore bed sores, and nobody's helping me with it. I need a new wheelchair. They ordered one for me 4 months ago, and I'm still waiting. I gotta get off of this thing. It's broken. I'm frustrated, totally frustrated, and they don't go away. So I keep threatening them that I'm gonna go have a bottomectomy.
Okay, Martha, that is, I think frustrated is an understatement. I would not say I was frustrated if I had wounds on my bottom. I'm going to Barbara Cass for that one. So Barbara Cass is from the Department of Public Health, so I'm going to look to her for that question.
So Martha, thank you for that question, and perhaps we can talk offline as well. But I think for the group, it's important to know that across the state, we've recognized that there are delays in wheelchair repairs, ordering of new wheelchairs. So the legislature this past session directed that we have a rehabilitation technology work group to talk about these issues. So the work group has been convened. One of the questions I had that I reached out to the facilitator early on, it speaks about the consumer, and it was important to me to make sure that consumer included all of you here, because for many of you, wheelchairs are your primary mode of transportation, so it's critically important. And I know, and I shared with Jeanette that I've been a nurse for more than 40 years, so I know in that 40-year span, if you lose your legs, and in this case, your legs are your wheels, you may be confined to bed. So it's critically important, and in the case of you, Martha, it's even more important that you get a new wheelchair to help with your pressure redistribution, to help with the healing of your pressure ulcers. So the wheelchair task force, which we are referring to it, has been convened. We are looking at these issues, what's causing the delays, why the delays, and what recommendations can this work group make to help facilitate that challenge, which is impacting your life. But we can also have an offline conversation about what's being done in the interim for that. So that's still happening, and we can't change that right now. But what can we do in this time period to change what your treatment plan is, what's been done to you holistically to help promote healing and mitigate risk of either further deterioration or further pressure ulcers. So we'll talk offline, Martha. Back at you, girl.
Good, and Keo is your RO, Martha, so connect with Keo, and Keo, you can make that connection with the building too. Okay, and I see we have a question back there from, yep, Jennifer?
Yeah, I just want to echo the housing problem again. I'm involved with, at the nursing home that I cover, people who aren't eligible for MFP. They do not meet level of care at this point. They're not eligible for MFP. They have no income, and there's no place to go. I would like to, maybe if the legislators are still here, I mean, there's something to do with the 211 system and how that operates, because people are really stuck. It's a lose-lose situation for everyone, because there's no place to go. And the wheelchair situation is serious as well. I've got one resident who can't go out without a wheelchair, and it's really a shame to see that happening. So, thank you.
So, Jennifer and others in this group, it would be helpful for me to report off to this, and again, we're calling it the Wheelchair Task Force Group, what the scope of the problem is as it impacts nursing homes or other residential settings, where, again, the reliance on your wheelchair is essential to the quality of your life. So, Jennifer, if you have any numbers you can share with me, or if anyone in here is having or sharing the same experience, please let me know. I know I spoke to the facilitator about this, and she's very, very interested in the impact to nursing home residents. So anything you can share, I'd be grateful.
And the issue related to access for housing for individuals who may not be at nursing home level of care, and it's creating a barrier for transition. This is something that we're seeing across the state and across the country. It's not just in Connecticut. Again, with DSS, I looked because Guy had been there. I know Barbara is aware of these conversations as well. It is a challenge. We've started to look at other levels of care, including residential care homes, right? And trying to identify another layer of housing for individuals where they can choose to live. It's really important to us that people aren't told where to go, and that we don't say all of these people need to live there, right? We need to have options, we need to have choices in all communities as well. It's really important that we don't force people to all live in one part of the state or in one area of a town, that we have housing available for people of all ages and abilities throughout the state in their communities of origin, so they can choose to live near the people that they are connected to and the services and the supports that they have. And then if they're ready to transition out of a nursing home, or if they just go to the hospital, that they have the ability to be discharged to the appropriate level of care and receive the appropriate supports. And we are missing sort of one of those levels, and we're aware of it, and I think advocates at all levels and all the departments are working towards how do we do that. And as of St. Patrick's Day last year, we do have the option to have residential care homes that offer home and community-based services, so waiver supports. But they have to meet home and community-based settings rules. And bringing them along has been a little bit of a challenge, but we're engaging in those conversations, we're working on that, and we're hoping to find new buyers that will want to come into the state, open new residential care homes. I know I've seen a lot of motion there, and it's something that we've seen a lot of interest in from our Office of Policy Management and the different departments. So I'm actually really hopeful that we'll continue to see growth in that area. Bobby?
Oh, yeah. I was wondering, did I hear it wrong that if a person is the level of care that they're receiving is rehab, if you have OT or PT, that would determine, like, let's say if you have 2 classes for like insurance A and B.
That's a Judy question, I think.
Medicare.
Would PT be considered as a Part B or something in your
under Medicare?
Insurance?
I think is what I was speaking about. Medicare has a number of parts, but the substantive coverage parts are Part A and Part B. What I was saying was that if you have Medicare Part B, that Medicare Part B or your Medicare Advantage plan can pay for therapy, physical occupational therapy for residents in nursing homes, even if you're not getting Medicare coverage for the room and board and for the overall cost of the care.
Okay.
Is that the answer? I mean,
Okay.
answer? Yes.
Yeah, you cleared that up.
Thank you. Glad.
Keo?
Hi, I'm Diane. I'm from Laurel Ridge, and I was a unit secretary. About your transportation, I've had many residents where they're either like stuck at their doctor's appointments and the transportation company never came or they forgot about us. Is there any answers to that?
So there is a new transportation, I wish Guy was still here, because we have a new contract. There is a new transportation company as of 2 months ago. Team, give me a hand, am I correct? 2 months? August 1st? Okay. E-board on top of it. So there is a brand new transportation company, and we're hopeful that under this contract and the new agreement, you will all start to see an improvement related to get access to your appointments, your pickup times, your wait times, and the outcomes for your transportation overall. If you don't, there are transportation complaint forms. Each of your nursing homes should have them, and they know how to send them into our office, and then we get them to an identified person at the Department of Social Services. Okay? There's a gentleman over here who's had his hand up for a while. Tosh, if you could walk, or somebody could walk over with a mic. Thank you. And then I thought I saw a hand over here somewhere.
Hi, I'm Bill Watson from Savita. I got a question about the agency that supplies nurses and nurses' aides. One, are they regulated?
Barbara, are they regulated?
So I didn't hear the beginning, sir. Are nursing?
The agencies that supply
Oh, okay, yes.
nurses and aides to the facilities, are they regulated?
So they currently are not regulated, but last legislative session, there was legislation that directed that DPH collect, so they register with us. So for example, Barbara Cass Nursing Staff Agency, I'm coming into Connecticut, I'm gonna provide services. I have to provide DPH, that notification, and register with DPH.
Now, are they employees, background checks? Because our employees have to have background checks before they work in the facilities.
So
Are they
that-
required to have background checks of their employees?
So, good question, and that typically is set up at the local level. So there's lots of work that's being done on developing further concepts around nursing staffing agencies.
So that's a no?
It's a no, that they're not required by DPH. Now, that list of all of those temporary nursing agencies has been sent to DSS, and they're looking and evaluating it right now. So there's more to come on that, sir. We're not done with that work.
Now, is the facility required to have background checks for these people that come in?
For the temporary, from the
Yeah.
temporary nursing agencies,
So
they're not required to, they're not compelled to participate in the applicant background check management system that is required of all nursing home employees in Connecticut at this point.
All right, thank you.
Thank you.
It's an excellent question. I heard someone call Tasha, but I didn't see where the question was. Oh, Jeanette.
I just want to make a plug about the transportation issue.
Yep.
Is that legislatively, that is something as the E-Board we are trying to work on so that there's transportation not only just for medical purposes, but also for mental health, which is recreation and being able to get out in the community. So as a force, as resident council presidents, this is something that we would really appreciate your support with. And if you are interested in participating in that, please let us know, because we would love you be part of the E-Board and fight for this part of the transportation.
Thank you. And also, yay, everybody clap for that. That is an important piece. There was a bill that I proposed a couple years ago, and I would love to see it come back again. I don't even think it should be a bill, but that individuals living in nursing homes are still members of the community. There is no reason why, if your community has transportation for individuals to move about town, to go to the senior center, to go to the library, to participate in life in town, you all should have access to that as well, at the same cost as any other individual in town. And it's not appropriate where we see a higher cost charged to individuals living in nursing homes than other individuals in town. And so that is something that we raised in previous years. It did not go anywhere. I think that it's discrimination. I think it's biased. And so I think we need to change that. We need to make it clear that it is unfair and that you are members of a community that just live in a different setting because it's where you receive your long-term services and supports. So it's also something you guys should get very loud about with me. Okay.
Question.
Yes.
Hi. Hi. So we use they have the preferred provider, the drop-down box on when we sign up for people for the wheelchair vans and stuff like that. We can't pick a provider, and it stinks because it just goes to whoever. And sometimes these companies don't show up. Sometimes they leave you stranded at the doctor's appointment. I don't understand why we can't pick a preferred provider for a wheelchair company instead of just giving it to any random Joe Schmo. Any clue?
That may be how the contract is set up. I honestly don't know, but that would be a question to send to DSS, to either the commissioner at DSS or to Guy, the Medicaid director, because they oversee that contract.
Okay. Thanks.
Yes, Keo. I'm giving you guys a 10-minute warning. We probably have 2 or 3 questions left.
Hi, yes. I want to know, what was the ratio for a CNA to the residents? Because these facilities are so short-staffed that, they're not getting the proper care that they should.
Absolutely. And so I'm gonna let Barbara Cass start that, and then I'm gonna take back what I said, and I'm only gonna take 2 more questions, because then I'm gonna talk a little bit about my legislative agenda.
So staffing currently right now is, we call it 3.0 staffing. So it's 3 hours per day per patient. In that 3.0 is a mix of direct care. So DNSs, administrators, all non-direct care are not included in that. It's specific to nursing assistants and nurses. I am happy to send you the policies and procedures that are directing that. I don't have the exact hours. When we're looking at the staffing, we're looking at first compliance with the 3.0. So from 7 to 9 p.m., there's a certain number of hours of nurses and nursing assistants that they need to staff for, and then 9 p.m. to 7 a.m. So the first foundational floor for staffing is, have they met 3.0? The second thing that we're going to look at when we're out on survey is, are they meeting resident needs? So even if they have 3.0 in place, are resident call bells being answered? Are medications being administered on time? Are Martha's treatments being done on time? That's also very critical, even if they've met the 3.0. And then the third thing we're going to do is talk to residents and staff to see how's it going with the staffing patterns there are. So there's a 3-legged stool to looking at staffing. I'm happy to share the policies and procedures with you so you can see the exact number of hours. If you want to just connect with me after, I'll send you to your email.
And the staffing should be posted in your building in areas that are accessible to residents at eye level, even from a wheelchair. And if it's a locked unit, it needs to be on the locked unit as well. It needs to be updated per shift, and it needs to reflect the accurate hours of the staff in the building. Not done once a day, but changed if the staffing changes in the building.
Can I add one more point to that?
Yes.
If any of our surveyors are in the building, and you have concerns with staffing, if you have concerns with anything, I would strongly encourage you to do some outreach with the survey team. Your voice is critical. The lived experience does matter, and it's going to help inform decision-making for the rest of the survey. So I would strongly encourage each and every one of you to speak to surveyors. It could be done quietly, privately, or if you want to call the department. If you still have some trepidation about speaking with anyone, you can always give us a call. Like Guy had mentioned, we also have a number that you can call, and we have an electronic complaint line as well. So thank you, Marie.
Yep. Liz?
I want to piggyback on that question and thank Barbara for the run through of all the details and the mission of care, not hours. There's a however, and the however is in going back to this woman's question about ratios, and there have been times through the legislative process and then some where we have in Connecticut started to address, and it went way back to NAWA, where we talked about a person-to-person ratio. My hope is that in the next legislative session we revisit that, because while we are all about the care, it appears to be so much easier if we look at an 8-to-1. It's something, I'm just throwing something out there, as opposed to the complicated nature of the breakdown of what, it's complicated. And we know that other states have gone this route. So my hope is that some of the legislators who brought it up on the floor this past session will keep that going, because I think it's easier for us to manage, and that would be one of my hopes for the next session.
Mm-hmm. So Liz, the only thing I would like to add to your comments in terms of ratios is, when we've identified significant issues in a nursing home, we have a toolbox, an enforcement toolbox that we can use. And one of those issues is, one of those tools is a directed plan of correction.
Could you say that again?
So if we should identify significant issues in a nursing home, and it doesn't have to be specific to staffing, it could be some other quality of life or quality of care issue. And one of the tools that we have in our toolbox is a directed plan of correction. So in those cases, we will often direct staffing ratios The other, and I don't want to call it an enforcement tool, but the other option that we have is a consent agreement. It's an agreement between the entity and the department, and the nursing home is going to agree to the following provisions. In those cases, I would say almost 100% of the time, we direct staffing ratios in those cases for all 3 shifts. But again, those are done when there's an enforcement action being taken. It's not routine. But we have taken that approach with applying staffing ratios, recognizing the value in that.
And one of the things that I am putting forward this session as a legislative request, and having 2 legislators here, I've already talked to them about this, is that if a facility, a nursing home, is not at 3.0, or if they're just at 3.0, that they not be able to admit other residents unless they're bringing other staff in, right? You cannot admit other residents if it's going to bring you below the 3.0. It's not fair to the residents, it's not fair to the staff, in order to have residents come in, which only benefits the nursing home, right? So if it's going to drop them, they shouldn't bring them in, and if it does, then they should have to pause admissions for a 2-week period where they're at 3.0 for that whole 2-week period. So that's my request this session related to staffing. Any other questions? And then I'll tell you some other legislative stuff. Yes, Bobby, one more.
I got one for DPH.
Okay.
It seems to me that DPH is the real watchdog of everything that really goes on in the nursing home. So I was just wondering, is there a possibility that DPH can themselves send in, let's say, an undercover boss, and they could get all the information that they need and for themselves?
Can you do an undercover boss?
So I really appreciate the concept, Bobby, but when all of our visits are unannounced, but part of our process directs right now, and it's directed in our process, that when we come into the building, we have to announce our presence, that we're there. But I do want to underscore in bold, every visit is unannounced to a nursing home unless it's an initial licensure inspection, and we have a moratorium on new homes. But the concept is, I appreciate it and understand it, absolutely. But the undercover bosses are all in this room, and when there are concerns or issues, we want to hear your voice. We have an 800 number, we have the electronic portal, and Maraith and her team, we meet weekly with Maraith. And Maraith's concerns and the team's concerns helps inform decision-making as we move forward as well. So that relationship has been critical as we prioritize our work, but your voice is critical to what we do.
Thank you, Bobby, and thank you, Barbara. One of the other things that I am really focused on this session is related to quality, and part of the work that Julie talked about. And as the Department of Public Health the Department of Social Services gets that information back related to nursing homes and the quality, we're going to have nursing homes that are high quality, right? They're incentivized to be high quality and to get surveys back from residents that are high quality. Then we're going to have some that come back that are mediocre, standard. And we're going to have some that come back that are low quality. And what are we doing with that once we get it? Just having that information is not okay with me, because once we have it, we're going to say, oh,
we need
okay,
a nurse.
We're coming. Barbara's going. We can't just say we're okay with just having low quality homes. And so because of that, I'm asking that for those low quality homes that we require that the nursing home have to hire from a certain list someone to come in, a consultant, to work with them on whatever those quality areas were, to bring them up at least to standard, so that we don't allow and pay for low quality homes in our state. And Health Centrics, we had individuals here from Health Centrics today, which are contracted by CMS to work on quality in our state. And I think they should be the people with the list, and they should be working with nursing homes related to that quality. So that's something we're hoping to move forward here to make sure that you're all in homes that provide quality care. So we are at the point of the day when we are ready to wrap up. Thank you all for being up here. We didn't have as many questions. We had a lot of Medicaid questions. Thank you all for being here again this year. It was wonderful to see everybody, and I can't wait to see you all again next year, and it sounds like we'll be focusing on some MFP. All right, so have a good afternoon. Get home safe.